Being home in North Carolina is always one of my favorite things. I'm still a North Carolina girl at heart, North Carolina girl in my accent. United Therapeutics is in the state that I love. I'm a pulmonary arterial hypertension advocate. We're at United Therapeutics. I'm on Remodulin. Diagnosis in general of anything, right, is scary. The season of life I was in was that I was invincible. And that's what every 20-something-year-old thinks. And I think it just really rocked our world. It shattered pretty much every conception we had of what our future would look like. My doctor came in, he was like, hey, there's a patient here in the area who has the same storyline as you. She's about the same age, she's got kids around the same age, her husband was also in the military. We told her about your story and she wanted to come meet you and we wanted to know if you would be open to that. And she just came in, she had her pump on her shoulder and her book bag, and she came down and she sat and she talked to me. She talked me through a lot of the things that you don't get in training in the hospital, a lot of the things the doctors and the nurses can't possibly tell you. And she just basically reassured me that it was possible to live a normal-ish life when I got out. I think it really pushed me in the direction of positive mental health, because I was really struggling. I just couldn't see it, but she was the vision of seeing it. And I thought if she could do it, I could do it. And that's where my advocacy journey started, was that I wanted to be her for someone else. And so I had posted a Instagram reel on symptoms that you should look out for. And I posted the reel, it went viral. Fast forward 3 months, I get this message from a girl. She sends me this long message. She's like, hey, I just wanted to let you know, I saw your reel. It pushed me to go get testing. I got diagnosed with the same thing you have in a severe form, and I wouldn't have had the courage to go and ask for the tests had I not seen your reel. And it was wild. So I've met her in person now, because that was 4 years ago probably. She's on treatment, she's doing really well. When I met her in person, I just sobbed, right? And she was my favorite part of my story is your part. And it was so cool. And I can tear up just thinking about it, but it's just been really cool. People ask me how I waterproof my sight, how I manage sight pain, how I maintain my mental health. People ask me about my armband all the time. I mean, the disease doesn't define me, but it's definitely a part of me, just like my tattoo is a part of me, and it's a permanent part of me. But I got this lung tattoo because I wanted an anatomical lung to remember that this is a real journey, right? And so I got the florals because there's beauty that comes from the hardship, and the hard stuff is really important, and that is why I did the anatomical in black. I did the florals in color because, you have to be able to see the color in the black and white, you know what I mean? It's not always just gray. I think people overlook the goal of just actual joy, and so I'm trying to find joy in the season that I'm in.
Remodulin treprostinil injection. What is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with New York Heart Association functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure, symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilatation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-844-UNITHER, 1-844-864-8437.